Hi, my name is Catherine Shelton. I'm enrolled in the Indiana State University LPN to RN bachelor's program, and this is my 5th health education project for nursing 444 community health nursing, and this will be focusing on hepatitis C prevention among the veteran population. So our learning objectives describe what the hepatitis C virus is, list ways hepatitis C can be contracted, describe some of the symptoms and potential complications, list reasons why veterans are at increased risk of developing hepatitis C, and describe the screening process and describe some treatment options for hepatitis C. So what is hepatitis C? It is a virus that attacks the liver and causes inflammation. This chronic inflammation causes the liver to swell and ultimately alters how the liver functions. HCV, which is an abbreviation, happens to be the most common blood-borne disease within the United States. It's important to note that the liver has many important functions, including removing toxins from the bloodstream, bile production, which help break down fats, cholesterol production, which is important for hormones, converts extra glucose in the blood into glycogen to store for energy, also breaks down glycogen stores when extra glucose is needed for energy. It produces plasma proteins like albumin and clotting factors, and that is just to name a few. So how is hepatitis C contracted or spread? It is spread when a person comes into contact with the blood of an infected individual. This could be through sharing needles with IV drug use, an accidental needle stick at a healthcare facility, blood transfusion where the blood was not screened for HCV. It can also be transmitted through unprotected sex and from a mother to her fetus. It is important for a mother to be checked for hepatitis C, as a study showed that 8 to 15% of babies are born with HCV when the mother was hepatitis C positive. So symptoms and complications. Symptoms of hepatitis C virus are similar to hepatitis A and B symptoms. However, within the first 6 months of contracting hepatitis C virus, the individual may not experience any signs or symptoms. Symptoms of HCV can include jaundice, right upper quadrant abdominal pain, fatigue, loss of appetite, nausea, diarrhea, ascites, which is a large accumulation of fluid in the abdominal area, a fever, and possibly itching. Future complications of HCV are very serious. A person should receive treatment right away if they test positive for the virus to prevent complications such as hepatic encephalopathy, which this occurs when the liver does not properly excrete toxins from the bloodstream. These toxins accumulate in the blood and travel to the brain and affect brain function. Many people with hepatic encephalopathy appear very confused and disoriented. Cirrhosis, which is a scarring of the liver, liver cancer, and potentially liver failure. So are veterans at a higher risk of contracting hepatitis C virus? A study was done in 1998 by PubMed, and it found that veterans did tend to have a higher incidence rate of hepatitis C. This was found to be the case, especially among veterans from the baby boomer generation, or those that served during the Vietnam War, as those were part of the baby boomer generation. The PubMed study analyzed a group of male veterans that served in the military during 1965 through 1974, the Vietnam War era. They compared the incidence rate of HCV among this group and a group of non-veteran males of the same age group. Although the reason for this is not entirely understood, it is thought the increase in the HCV rate is thought to be due to exposure during medical treatments performed on the field. increased needle sticks, and possible contaminated blood from transfusions. The study also concluded that injection drug use was higher among Vietnam veterans compared to non-veterans among those that participated in the study, leading to an increased risk of contracting HCV among these Vietnam vets. So what is the VA doing to help veterans with HCV? In 1998, the Veterans Health Administration started the National Hepatitis C program that serves to test and treat veterans for HCV. The program first focused on that baby boomer generation, which included the veterans from the Vietnam era. The program has since expanded to testing veterans and military personnel that are 18 or older. A blood test is used to detect whether the HCV antibody is present or not. If the antibody is not present, the veteran is not enrolled in the program, and continued periodic testing is done for non-risk veterans. The high-risk veterans should be screened more frequently. If the HCV antibody is positive, the veteran is then tested to see if they have an active infection. If an active infection is present, the veteran will be enrolled into the Veterans Administration Liver Clinic, and HCV treatment will be initiated if the veteran consents to treatment. If no current HCV infection is present, the patient will continue to be monitored and periodically tested as appropriate. So what treatments are available for veterans with HCV? Unlike hepatitis A and B, there is no vaccine for hepatitis C, but most cases of hepatitis C can be cured with medications called direct-acting antivirals, or DAA. A combination of these medications tends to be prescribed by the healthcare provider based on the patient's viral load, genotype of the virus, and if there is any type of liver damage present. In 2014, oral version of direct-acting antiviral medications became available, which has significantly increased the number of veterans who have received treatment and a cure for hepatitis C. There have been many advances over the last several years in the medications to treat hepatitis C that have reduced the side effects and improved treatment outcome. Some treatment plans can be as short as 8 weeks. And the goal for the patient is to have no detected virus 12 weeks after finishing the treatment. And here are several resources to look over. The first one is a site that provides a wide array of information for veterans, including what Hep C is, what treatment options are available, patient considerations, alternative therapies available. I also wanted to include a site that provided financial assistance options for veterans, and then the Hep C patient education resources from the CDC. And we will now go over that pre-test that we took at the beginning, and we will retake that test to see what you have learned. And here are my references, and I hope you enjoyed my presentation. Thank you.